Hello, and welcome to a new episode of the Wonder Tooth podcast. How is everybody doing? I hope everybody is fine and enjoying the weekends. Today, I am going to talk about how can we as dentists make you guys look younger. Okay, a lot of the patients, they come to me and they're like, this is my picture when I was like 30 years old or 40 years old. I'm now like 60 or 70 and my whole face looks different. And how can I fix that? And I look and I do my clinical exam, I do the radiographic exam, and then we come up with a little conclusion. Your skin, you can get some wrinkles here and there, and then you can fix this, little injection here, little Botox here, or little filler there. So your teeth, they do age also. How can we fix that? How can we basically take your teeth back to your 20s and your 30s when, your whole face was lit up and you felt gorgeous? Of course, you're gorgeous anytime, but you wanna, preserve yourself. So how can we do that? So there are a few things that dentists can do to help you achieve that. And one of them really is in your hand, guys. It's not even us, it's in your hand. It's by brushing and flossing and cleaning properly between your teeth, maintaining your dental health, maintaining your oral health. And how can you do that? Every day, we need to brush twice a day, soft toothbrush, electric or manual, I don't care. If you would like to use the electric in the morning or the manual at night, that's fine, as long as there is no plaque left behind. Flossing is very, very, very important, and I really hate this stick. It's better than nothing, but if you can use the string basically to clean properly between your teeth, that would be fantastic. And if you can just use like a little water pick to kind of flush between the teeth to keep it clean. This is an extra. This does not really stop you from using a floss. You still have to floss. So these, if you can do all these three and maybe rinse with a little bit of warm salt water here and then, that would be fantastic. And why is that? Why this can actually keep your teeth look younger and healthier? Because first of all, if there is plaque involved and left, so the minerals from the saliva will come and sit on the plaque and basically will make it harder. And the bacteria will come and sit on top of that because they love any surface that's a little rough, and they will sit and then they will start to produce acid and enzymes, and then the gum will start to be inflamed. And this is when you brush, it's like, my gums are bleeding, I don't know what's going on. Well, this is what's going on. You have bacteria now that's sitting on the tartar, which is the hardened plaque. And the plaque is because it was left from, debris that are left there, food debris or some bacteria, sitting on them. So once the gums start to get inflamed, this is gingivitis, as long as we don't have pockets. If we start to get pockets, which basically, this is the root and the bone is surrounding it. How is the root attached to the bone? By a little tiny ligament. If the bacteria is able to get inside that ligament, they can start to eat it, and then you have what we call a pocket. And we hate pockets because the bacteria, oh my God, they have a little cave, they have a little nest, they go inside, they multiply, they eat the ligaments even more, and then we have a bigger problem because the bacteria and the plaque is inside. You cannot, even if you floss like hard, you cannot remove that. This is when you have to go to the dentist and get that cleaned professionally, which we call it a deep cleaning. So what happens with deep cleaning, or what happens before you get to the level of deep cleaning? Remember gingivitis? This is when we check and there are no pockets. This is still reversible. You brush, you floss, you get your cleanings done properly, by the hygienist or, professionally. The gum can revert back and it can stay healthy. But if the pockets are there and the bone is basically starting to shrink, so the bone is gonna shrink, taking the gum with it. And this is when people start to come and say, I see black triangles between my teeth. I never had that. Well, this is basically because you're getting now some gum recession because the bone underneath it is receding. So both the gum and the bone are receding. We're getting those little black triangle. And when you look at yourself in the mirror, you see these and it's like, okay, I look older, I look different than before. How can I fix that? Well, one of the biggest, very early preventative measures is to brush and floss regularly. Every single, don't skip a day. Don't like, I floss like once a week. Oh, it's twice. When I remember, please, brush twice a day, floss at least once a day. I basically floss after every time I eat. And I'm like, I'm serious now, because from what I see, I'm like, I don't want to even get into. So my gums are in a good shape right now. So flossing, a little bit of warm salt water, and a little bit of water pick too. You can find this anyway, like anywhere, like any pharmacy or anywhere really. You can find it online too. Any water pick, it's just to kind of flush, but you still have to floss. So this is the very first way to preserve your teeth. Like we tell the people, or basically we've been told to preserve your skin, you have to put moisturizer, lots of one. Then you have to put, if you're going out in the sun, you have to put sunblock to preserve your skin. You don't want to get, any cancer, God forbid. So this is basically what you do for teeth. You just brush them, floss them, and keep them happy and healthy. That's really it. It's not a big deal. Okay. Let's say we are past that, the teeth now are getting a little darker because, aging, or because we didn't really maintain them well, because you can also listen to my previous episode about the teeth yellowing. So the causes of teeth yellowing, you can hear that in the previous episode. And how can we prevent that? How can we reverse that? Well, you can use some whitening products. I highly recommend, don't use the DIY products from, like little bit of powder, I don't know what, and peroxide, and just you brush with the hard toothbrush, and then the fillers will remove, the large fillers will remove the outer layer of the enamel, and then, yes, it's gonna look white for a little bit, then after that, keep doing it, and then it's gonna become very sensitive because the enamel, the outer layer of the enamel is gone now. So some teeth whitening, I would use professional teeth whitening. The one in the store, some are okay, some are not okay. The whitening strips, I hate them because you don't have really, you cannot control where they're sitting. So you don't want the whitening to sit on your gum because it can cause your gum to become very inflamed and you might end up with gum recession. So maybe the tray is better, or you can go to the dentist and get custom made. So custom made tray is much better because it's shaped according to your teeth, and basically the area that's gonna engulf in it the gel, the whitening gel, it's away from your gums, so it's protecting your gums. That's one. This is like the take-home whitening trays. It's a customized tray. It's very easy to do, and you can ask your dentist about that. That's an option. The other option, okay, let's say I have a wedding. I am, I have a big event at work. I have to get my teeth whitened. So you can also get the Zoom whitening or any professional in-office whitening. And this is when you sit under the light, and basically we have to put something to retract your cheeks. We have to put something to protect your lips from outside. We put something to protect your gums. We even put something like a rubbery thing to protect your gums completely, to cover it completely when we start to put the gel to whiten your teeth. So whitening can help, but it's not really permanent. Whitening can be good for like maybe 6 to 8 months, then you need to do the touch-ups. And some patients, they come every couple of years to get some whitening done, the professional in-office whitening done. And the touch-ups basically are, you get the custom tray and you get the gel and you do it at home, especially if you had the in-office whitening done before. So we spoke about brushing, flossing, keeping a good oral hygiene is definitely number one. And number two is, some teeth whitening. Okay, number three is conservatively try to get the amalgam fillings replaced. The silver fillings that you have in your mouth, try to have them replaced. I wouldn't do them all at once, maybe do a couple at a time. And this is because they contain mercury, so the mercury is not going to leach into your body basically when you are eating or drinking. But if parts start to chip from that silver filling, you are swallowing this, that goes into your lungs, God forbid. It's not a good thing. And also when the silver fillings are being placed into your teeth, this is when mercury vapors are very active, and also when they are removed. And that's why we usually use very high suction. When we are removing silver fillings. And why we don't really like, so I mean, it used to be the standard of care back then in like, maybe 20-30 years ago, but right now the silver fillings, unfortunately, we have to cut a lot more from the tooth to be able to pack it into the tooth. We used to call it extension for prevention. So if this is the tooth, the cavity is here, I cannot just drill this part and put a silver filling. It's not gonna hold. I have to kind of open the tooth a little bit more and in a certain direction, basically, to be able to pack the silver filling in. But that means I am compromising the thickness of the tooth itself. Do you understand me? But the composite back then, it wasn't really that good. It wasn't that strong. Right now they're very strong and they are very conservative. So if the cavity is like a tiny little area here, we can just drill this, clean it up, put the filling, done, without having to open the whole thing. That's number one. But number two, also, the amalgam, it's an alloy. It's an alloy of metals, basically, and they are mixed together with mercury. So they get sometimes incorporated inside the dental tubules. Remember, I said before, the enamel, the outer layer of the tooth is the enamel. It's inorganic material, 98% inorganic. Than the dentin, that's the layer underneath it. It's a living tissue. It has more organic material, and it has the dentinal tubules. And sometimes the particles from the amalgam, it gets incorporated inside. And then if you go to the dentist and get that silver filling removed, you still see like dark. The tooth looks gray. Yes, it does look gray because unfortunately this is incorporated in the dentinal tubules now. And a lot of patients are like, well, I had that removed, but the tooth still looks a little grayish. And I say, yes, because you had a big amalgam filling there. And in order for me to really cover this, we're gonna have to cut the tooth even more. So whether I have to put just a regular white filling, but you're gonna still see a little bit of gray, or if you don't like it, then we have to do an onlay, which is like a porcelain part that's like indirect restoration, and we kind of glue it on, or even a crown. So silver filling, try to get rid of them, little by little, try to get rid of them. Also, dental veneers, porcelain veneers, not just composite veneer, porcelain veneers. This is really the best way to give yourself a younger look. And how does that work? What are porcelain veneers? So porcelain veneers, it's the ladies would understand what I'm saying. When you go to the salon, the nail salon, and they put that little nice acrylic and they make it pretty and they can color it. This is basically what porcelain veneer is. So it's a very thin layer of porcelain that we can glue on your teeth. Remember, there is something else called lumineers, which I hate them because they destroy the gums. And lumineers is basically kind of ready-made, and you kind of glue them without even roughening the tooth surface. So it sits on top of the tooth. So it literally sits like this. So there is a little edge. You see that there is a little edge. That edge is gonna collect plaque and cause a lot of inflammation in the gum. And remember what we talked about, the gum is gonna start to recede, and then we're gonna, basically destroy the gum. So the veneer done professionally, you have to kind of make almost like a little indent into the tooth so that the thin porcelain can sit within that, okay? And that can transform completely the shape of the tooth and the design of the smile. And how is that? Because, with years and years of eating and drinking and grinding, your front teeth start to become like a flat line. If you look in yourself in the mirror, and you're a little older, look at yourself and you're gonna see your teeth are flat line. That makes you look older, period. Like even if you're 30 and you're grinding so hard, that's gonna make you look a lot older, unfortunately, because it shows, okay, years of grinding, and then your muscles start to kind of collapse a little bit with that. So how can veneers fix that? Because veneers gonna reshape the teeth. And when you're smiling, you have to see that there is almost a curve, around the teeth that's following the lip, your lower lip. So when you're smiling, you can see that. If you are smiling and you see like a gap between your teeth, the tip of your teeth and your lower lip, that means that needs to be built. And how we can build it, we cannot build it unfortunately with a white filling because it's gonna crack, it's not that strong, but porcelain veneer can. And usually I would say, if you're gonna do like veneers for like a smile makeover, don't do 2, do whether 4 or 8 or 10. So this is another way of basically making your teeth look younger and your whole smile look younger, especially, you know, if you are preserving your skin as well. And it's not just when you have like flat teeth, but also if you have like chipped teeth because of grinding, or you bit on something hard and now you have, you know, like a big chip in your tooth and we don't know how to fix it. So a mix sometimes of crowns and veneers can fix that for you. And porcelain is the best. Don't go for crowns that are metal with porcelain in it, because they just look horrendous. And then if the gum starts to recede, you can see that little black line, and just go for porcelain. It's the best. So now we spoke about different ways of giving you a younger look, and also orthodontic treatment. So if you have your teeth like really crooked on top of each other, it makes you, you know, you cannot really maintain your teeth properly. You cannot clean them. You cannot see that nice smile that I'm talking about. They are like crooked and on top of each other. So really you have to consider straightening them. Straightening them at this point is not really just cosmetic, but this is to keep the function properly. If you want to keep your teeth until you are like 100 years old, I would really advise you to have them nice and straight. Get some braces done, get some aligners done, clear aligners, something that can work, and basically something that can shift your teeth to make them properly positioned, because also that's going to help restore your bite. So if you have like crooked teeth like this and you're trying to bite, what's gonna happen? The edge of the teeth in the back, they're gonna start to flatten out, and then you're gonna need some sort of rebuild. Like, we need to rebuild the teeth, because now they're getting shorter because you're not biting properly. Your teeth, you're supposed to intercuspate, well, like this. Really, the top teeth should be from outside, but if you have like the front teeth are edge to edge, so your front teeth are gonna start to be flat. Remember what we talked about, flat teeth in the front, that makes you look older. So they're gonna be flat, but also your canines should be the longer teeth, so when you are eating or sliding side to side, they should be protecting the rest of your teeth, which we call canine guidance. So restore, you know, orthodontic treatment, braces or aligners can definitely help your teeth to make them look younger. Sometimes after, you know, you are done with aligners, some patients, they like, you know, now that with after years of you know, having them so crowded, the teeth, they look off, because, you know, there is a chip in that tooth from really, you know, hitting it the wrong way. And then sometimes after the bite is completely fixed, we can go and put veneers on it to have, you know, the optimal solution now. So they are in a proper position, and also they look beautiful and they look great. And also remember those black triangle we spoke about earlier in the episode, when the gum starts to recede, that can be closed with veneers or with porcelain crowns too, so that, you know, so then when you smile, you can see, you know, no black triangle, the gum looks good, and, you know, it's following the lower lip of your mouth. Another big one too is the gum contouring or gingivoplasty. And what is that? So sometimes patients, when they smile, you see like a gummy smile, you see more gum than it should be, and this really should be fixed, because it doesn't give you that nice symmetry in your smile. So how do we do it? It's very simple, really. Of course, you have to go to an experienced dentist to do that. Like, don't go to anybody and they'll go with the scalpel and just cut your gums. You have to have a certain measure. First of all, the gum has to be completely clean, no gingivitis, no gum disease at all, but just like it's extra redundant gum. So we usually reshape the gum, because when you smile, you want to see that little festooning around the teeth. You know, it's not like flat, and it's not like the two front teeth, they're very high because the gum is high, and the two teeth on the side is, the gum is low, so they look short. And then when you smile, you're like, what's going on? Something is off. I just had a patient actually last week, same exact thing. The two teeth on the side, the gum was kind of drooping on top of the, so I had to kind of recontour. Very, very easy. We numb the area, and then with the little laser, we just kind of reshape it. There is no bleeding, there is really nothing, and we just kind of clean it up, and that's it. So the gum contouring too can give you that nice full smile, you know, especially if you're planning to have the veneers done. So you don't want the veneers to be done and your gum line from the top is crooked. Okay, so we spoke about different scenarios today, basically that can help your smile and your face looks a lot younger. And the last one is gonna be implants. So implants, of course, it's a very important subject, because sometimes in certain patients we cannot restore the teeth with a filling, or like it's beyond restoration now with the veneer or with the crown. Let's say the root is cracked, the tooth has to be removed. So what do we do now? We have a couple of options. One of them is put a bridge, like a porcelain bridge, especially if it's a front tooth. But that's gonna entail, you know, we have to shave the two teeth on the side. Or we can get implants placed. And how do we do that? So the implants, basically, before we even touch anything, you have to have a 3D x-ray done. A small x-ray is not enough. You have to get a three-dimensional x-ray, because this is what's really gonna show the thickness of the bone, the height of the bone that you have available, and also if there are any important structures there. Like if it's on the top here, you have your sinuses, it's down here, up here you have your nasal cavity, you don't want to touch that. Down here you have the big nerve, you don't want to touch that either. So and also you want the implant to be within the bone, not going this way or that way. So that has to be done after you have a CBCT done, and this is we have it in the office, we use it often. And also, you know, like experienced dentists, you have to make sure that you don't get just a small x-ray, okay, let's put the implant now. It's not enough. So implant in the aesthetic zone, it's a very challenging case, especially if it's a one single implant. And why is that? I always say to patients, fixing one front tooth alone is the most challenging thing to a dentist ever. And why is that? Because we have to follow the contour of the other tooth. We have to kind of make sure it looks exactly the same, and the implant has to be placed in the right position too. So the right position means that the implant should be positioned a little bit more in, you know, because you don't want it to be more out, then you end up with like a really long tooth. Has to be more in. And I really like to use porcelain to cover the implant, not zirconia. And zirconia is like a white, it's a white crown material, but it's not porcelain, so it kind of blocks the light, so it doesn't look very natural. Well, I think we spoke about a lot. And of course, once you have veneers done or implant done, how to protect the rest of your teeth, get yourself a night guard. I will always keep saying, get yourself a night guard if you are grinding or if you are clenching. And make sure you also get checked for sleep apnea if you do have you know, some snoring going on, or if you are grinding your teeth very hard at night. So today we spoke about different ways that the teeth can be fixed and the dentist can help you look younger. One of them, it's you guys brushing, flossing, water pick, and also go to your dental visits, obviously, you know, every 6 months or every 3 months, you know, if you have some gum problems going on, or, you know, to get some maintenance for the gums. And number 2 is gonna be whitening your teeth. And we touched base about different kinds of whitening, and there is an episode dedicated specifically for teeth whitening. You can listen to that to have more details. And we also spoke about dental veneers and how they can help you achieve, you know, that younger look, your teeth that you had when you were 20 years old and you want to have them back again. And you can, you know, of course, get your teeth whiter with the veneers, and you don't need to get whitening anymore. I mean, you just go for a really light color and you're good to go. And also we spoke about replacing the silver fillings with white fillings. And we also spoke about implants and how they can fix, you know, a problem in the front or even in the back if the tooth cannot be saved at this point. And also the gum contouring or the gingivoplasty. Okay, I hope that was an informative episode today, and I hope you liked it. And if you liked it, just please leave me like a comment down there, or if you have questions, feel free to send me questions. And also you can reach out to our office if you